Welcome back. It is something that doctors see most often in young diabetics whose symptoms have not been closely monitored or controlled.
So tonight in Health Watch, a closer look at diabetic eye disease. Wendy Kuschel explains.
Glaucoma specialist Dr. Joseph Berman and vitreoretinal surgeon Brian Perkovich with Aurora Bay Care recently teamed up to care for Brandon Tangway of Marinette.
I wasn't taking care of myself the way I should have been.
He's been diabetic since he was 9.
It started out with just the white spot in my right eye, and I came down here and he took a look in my eyes and realized just how bad everything was, and it got to the point where I couldn't drive.
Turns out he was having complications with his diabetes in his retinas,
which in Brandon's instance were literally threatening to make him blind. He had not only bleeding in the back, abnormal blood vessels, but he had resultant glaucoma from that. And so we needed to get several of us involved in trying to combat that scenario. Used laser to try to control the abnormal blood vessels in the back of his eye.
Surgery to remove scar tissue and injected medication to control swelling. Dr. Perkovich says
his pressure after revising his tube shunt and picking appropriate medications has stabilized and is in a range that is healthy for his eye. We took out his cataract, which had developed partially from his treatments, but partially from his diabetes.
Brandon now has his diabetes under control.
Without the interventions and without better control of his diabetes, it is highly likely that he would have eventually ended up completely blind in that eye.
I think there's a couple take-home messages here. One, that if you're diabetic, the importance of controlling your blood sugars, your blood pressure, your cholesterol are really paramount to trying to delay or prevent these sorts of complications. Secondly, if you're diabetic, you need to come in for routine exams to detect these kind of things as early as possible so that we can address them at a much earlier and less severe stage.
And when people tell you, hey, this stuff can't happen, it really can happen.
If you have more questions about diabetic eye disease, you can call Aurora Bay Care or email healthwatch@aurorabaycare.com. That's Health Watch. I'm Wendy Kuschel, Local 5 News HD.
Thank you, Wendy.